In this video, we will discuss about frequent urination, such as needing to urinate every 2 hours, can result from various factors, including high fluid intake, urinary tract infections, UTIs, diabetes, bladder conditions, kidney issues, medications, or prostate problems in men. Home remedies to manage this include reducing fluid intake, especially before bedtime, avoiding diuretics like caffeine and alcohol, doing pelvic floor exercises and bladder training. Dietary adjustments and herbal remedies, such as corn silk tea and pumpkin seeds, may also help. If symptoms persist, involve pain, or include blood in urine, it's important to consult a doctor for proper diagnosis and treatment. Here are some possible reasons for frequent urination and potential home remedies. Join us as we delve into the world of nutrition and discover how small changes can lead to big health benefits. Let's embark on this path to a healthier, longer life together. Whether you're looking to boost your immune system, improve heart health, or simply feel your best, these superfoods offer delicious and effective ways to enhance your diet. Possible causes: 1. High fluid intake. Drinking large amounts of fluids, especially those with caffeine or alcohol, can increase urine production. 2. Urinary tract infections, UTIs. Infections can irritate the bladder and cause frequent urination. 3. Diabetes. High blood sugar levels can lead to increased urine production. 4. Bladder conditions. Overactive bladder syndrome or bladder inflammation can cause frequent urination. 5. Kidney conditions. Kidney infections or stones can lead to increased urination. 6. Medications. Diuretics and certain other medications can increase urine output. 7. Prostate issues in men. Enlarged prostate can obstruct urine flow and cause frequent urination. Home remedies and lifestyle changes. 1. Monitor fluid intake. Reduce the intake of fluids, especially before bedtime. Avoid diuretics like caffeine and alcohol. 2. Scheduled voiding. Try to urinate at regular intervals rather than waiting for the urge. This can help train your bladder. 3. Pelvic floor exercises. Strengthening the pelvic floor muscles can help manage an overactive bladder. 4. Bladder training. Gradually increase the time between bathroom visits to help increase bladder capacity. 5. Dietary adjustments. Avoid spicy foods, artificial sweeteners, and acidic foods that may irritate the bladder. 6. Maintain healthy weight. Excess weight can put pressure on the bladder, so maintaining a healthy weight can reduce symptoms. 7. Warm compress. Applying a warm compress to the lower abdomen can help relieve discomfort from bladder spasms. 8. Herbal remedies. Corn silk tea acts as a diuretic and can soothe the urinary tract. Parsley water, natural diuretic that can help flush the urinary system. Pumpkin seeds, known to improve bladder function. When to see a doctor: persistent symptoms. If frequent urination persists for more than a few days without improvement. Pain or discomfort. If you experience pain during urination or in the back or lower abdomen. Blood in urine. Visible blood in the urine is a sign to seek immediate medical attention. Other symptoms, such as fever, chills, fatigue, or sudden weight loss. Conclusion: while home remedies can help manage symptoms, it is crucial to identify the underlying cause of frequent urination. If you suspect kidney issues or any other serious condition, consulting a healthcare professional is important for a proper diagnosis and treatment plan.
Thank you for watching. If you like video, then click on like and subscribe the channel for more updated videos.